Hi, I'm Dr. Julie Steiner. Let's talk about a condition called vertigo and how we treat that. So, a lot of people experience symptoms of vertigo, and in fact, about 35% of the population over the age of 40 has maybe experienced vertigo in their lifetime. It can occur as a result of like a sinusitis or maybe a viral, infection like a cold. Certain people may experience it due to medications that they've taken, and also if it's a traumatic brain injury or a stroke, brain tumor. There are a lot of reasons why people may experience vertigo, which vertigo is the sensation that you're dizzy and like, oh, you feel like things are moving, but it's not moving and you don't see it moving, but you just can't help feeling like you're kind of in this swimmy motion. Okay, now there's another condition also called Ocelopsia, and with this condition, people actually see things moving even though they're not. So to look out and feel like, wow, things are just like cycling in a circle on me. You can have a combined vertigo with Ocelopsia, which is really actually pretty terrible to have to deal with if you've ever experienced it, and I have. Now, let's talk a little bit about, well, what do we do to actually treat it? So we may have to combine treatment by pulling in other professionals to help us, depending upon what's going on with the individual who has the vertigo. So it may require, particularly if it has to do with like the inner ear, it may require us pulling in the help of a physical therapist or a PT. And that person can kind of help, especially if it depends upon the position in which the person is laying or sitting or moving their head that causes the vertigo to come on. Those all things that would kind of indicate like the inner ear is maybe an issue, and we would need to work on that with a physical therapist. Now, if you are experiencing vertigo as a result of maybe a virus or medication or something of that nature, then we would probably pull in the help of a professional who is a holistic nutrition doctor, and they can help us go through the process of helping you detoxify your brain or whatever needs to happen in order to support you for best health and recovery from your vertigo symptoms. Now, what do we do? Because I've talked about some of these other people we pull in, but what we do is we use photosynthonics or light therapy to electrically trigger the eyes and the brain to function better together. It's very common for patients who have vertigo to also experience a strabismus or an eye turn. Might be in, could be up, could be out. Super common though that we see it in or up, more so than anything else. And so it's kind of the combination, particularly the upward, which is called a hypertropia. That's a specific kind of strabismus that causes a lot of problems of like vertigo for people. And so syntonics can help us to electrically trigger the brain to send that signal to the muscles of the eyes and teach the eyes what they need to do for proper alignment. Now, in addition to that, we're also going to do kind of traditional vision therapy, which is a little bit more motor or like movement oriented, where we might have you tracking and patching. With one eye, you might be tracking and looking at objects as they move. In the beginning, depending upon how bad your vertigo or Ocelopsia is, we may have to do things fairly minimalistic so that we're not triggering it to get worse. But as you get better, we can incorporate head movement and body movement with your therapy to improve how your brain is functioning. Now, we want to incorporate those things in order to help you be able to kind of sustain looking out at things, whether or not you're sitting down or maybe you're riding in a car, or maybe you just want to go ride something like the teacups ride at an amusement park or something. Those are definitely situations that people that have vertigo would probably are not as thrilled to do, and driving obviously is super important. So we want to be able to help you out. Again, we're going to use photosynthonics and general vision therapy in conjunction with, if we need to, other professionals like a PT and a nutrition holistic type of doctor to help you. Now, once again, if you want to contact us, you can call us at 618-288 $14.89 if you're local. If you're not local, go to our website at visionforlifeworks.com, and you can do one of two things. Either you can fill out a questionnaire, or you can click on the button that says schedule a consultation direct with me. And if you like this video, like it. If you do feel like someone would benefit from it, please pass it along. And also, if you've not subscribed to our YouTube channel, you need to do that, because we talk about amazing topics all the time and you don't want to miss any of them. Thank you.